All right, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health, Dayton and Montgomery County. Thank you for being here today. We have a variety of speakers again to help inform our community. We have Mayor Nan Whaley from the City of Dayton. We have Helen Jones-Kelly, Executive Director of the Alcohol, Drug Addiction, and Mental Health Services Board for Montgomery County. We have Sarah Hackenbrack from the Greater Dayton Area Hospital Association. And we have, yes, again, Dr. Michael Doe from Public Health, our Medical Director. So today's news conference for the Governor and the Lieutenant Governor and the Director of the Ohio Department of Health was a really positive message for a lot of the information that was presented. So we get closer and closer as a state to being able to offer an antibody or antigen test, a blood test, a much more rapid test to determine infection or past infection. We talked yesterday at this news conference, and then it was mentioned at the state conference today about the new reporting criteria for cases, and that we'll be doing both confirmed and probable case reports. Obviously, reference to the great work that food banks are doing. We all learned again that distilleries are producing hand sanitizer. I think I'll order a bourbon flavor, but some may choose a vodka flavor. Food trucks are now permitted at rest areas, provided that, to serve our truckers per se, provided that they have a new permit from the Ohio Department of Transportation. Also, we learned today that transit authorities, there's new guidance for the transit authorities throughout the state. Individuals using transit should be essential businesses and/or those examples by which individuals are permitted to leave their home for essential activities. And we would be asking all individuals that use public transit to wear a cloth face mask. Okay, so a couple of items that we wanted to cover here today for public health. Obviously, we continue to still get a lot of questions around essential versus non-essential businesses. So we're doing our best to work through that list that we have on our website. I believe we have an updated list on the website today. And as of today, we issued 3 additional orders to cease operation. One was for a video game shop, the other 2 for smoke shops. It's also important that for those entities that receive a cease order or an order to cease operation from us, that if they feel we've made a different decision than another health department that has a similar type operation, that there's a statewide dispute resolution commission that then looks at that conflicting decision made among different health departments and then makes a final recommendation that then the governor and the Ohio Department of Health would then support. So that's an important process for individuals or businesses that we've issued an order to cease operation. If they feel we're making a different decision than another county health department, they should use that state process. That Dispute Resolution Commission has 3 representatives. It's a representative from the Ohio Development Services Agency, the Ohio Department of Commerce, as well as the Public Utilities Commission of Ohio. They have a really difficult job, no question. But so our perspective would be just because a business provides a good or a service that's essential doesn't mean that they are essential. As a business, we look at the core function, the core business of that entity, and that's how we make our determination. So I'll give you an example, and we've referenced previously that we've issued a cease order or an order to cease operation to smoke shops. You cannot be we all understand that a smoke shop is in the business to sell tobacco and tobacco products. That's their core function. That's their core business. Just because they sell snacks or have a beverage machine or sell over-the-counter type medications such as Tylenol or Advil, that doesn't mean they are a convenience store. They are a business in place to sell tobacco products, and that's how we make our decisions. And I think what will happen is that type of logic that we're applying will be reinforced by the decisions of the Dispute Resolution Commission at the state. So then obviously the second topic we should talk about, because it was apparently referenced on the governor's news conference today, is leaving home for essential activities. And we talked a little bit about this yesterday. We had a question from one of the media on the phone. The stay-at-home order says that individuals are permitted to leave their home for essential activities. That's not fun for any of us. We get that. So it's if there are health and safety concerns, if you need necessary supplies or services, outdoor activities, and those are specifically defined to get exercise, essential businesses and operations, and we know who's on that list, or to take care of others. So the issue has come up periodically about vehicle parades. And at Public Health, we were never focused on that. But as we've received those questions, as we look through the order and we make our determination, certainly vehicle parades do not fit the essential activities necessary to leave our home. We have a stay-at-home order from the state. We're trying to make decisions uniformly among all health departments in this state. And so the order to stay at home has specific reasons how individuals can leave the home. There's also still in place an order to prohibit mass gatherings. And I get it that we can define parades in different ways, but leaving the home to do a vehicle parade is not an essential activity in our mind. That's how we've interpreted this and how many health departments are interpreting it. No, we are not the we are not the parade police. We understand that. Several jurisdictions have also contacted us saying they have been asked to sponsor larger vehicle type parades, as well as their law enforcement representatives to lead those parades. And our response has been consistent. That's not an essential activity. Those can be done at a later time. So that's how our interpretation is of the stay-at-home order. Certainly, if the governor and the director of the Ohio Department of Health would want to amend the amended order and make an exemption there and add additional criteria under essential reasons to leave the home for outdoor activity, we would welcome that. But for now, that's how we are interpreting the stay-at-home order. Okay. Also, we have spoken at length in past news conferences about just because we have a pandemic underway does not mean that other diseases and issues and public health problems are going to cease. So we all understand that heart disease and cancer are going to continue to happen. Accidents will continue to happen. People are still going to be hungry. Violence will still occur. And babies are going to continue to be dying. That's a tragic consequence. Also, individuals are going to continue to overdose unintentionally on illicit drugs. And we've referenced in the past couple of news conferences that we're starting to see an increase now for the past several months in these overdose deaths. And so Helen Jones-Kelly from Adamus will be here today to give us some ideas and some guidance in terms of how, as a community, we should respond to that increase. And with that, we'd like to welcome Mayor Nan Whaley to the podium.
Thank you. Well, good afternoon. Happy Easter weekend to everyone. Want to just be very brief today, since I think the commissioners covered all the different issues that we're moving forward with, but also just want to thank the faith-based community. This morning we had a very early 8:30 call. Commissioner Cooper and Dr. Doan were on. Appreciate their work on it, answering questions both about Sunday services and the increased ask of us, of public health, the city and the county, to not congregate this weekend, and appreciate all the ministers that are doing their work to make sure that they are doing their services virtually. We got good support from that on the call today, and appreciate the work that they're doing, and also had good discussions around the work that we need to do around this disease, but most disease having racial disparities in our community as well. So we'll continue to have those conversations. Want to encourage everyone again, as we try to encourage the wearing of cloth masks, that people, if they make extra, to please donate them to City Hall again. from 8 to 5, Monday through Friday, or you can mail them at 101 West 3rd Street, Dayton, Ohio, 45402. And here's hoping that we have a nice, quiet, safe weekend. Hope you all have get good exercise at a good distance away from your neighbors. Have a great weekend.
Thank you, Mayor Whaley. Next, we have Helen Jones-Kelly, Executive Director of Adamus.
Thank you so much, Commissioner Cooper, Mayor Whaley. I just want to share a couple of really quick things, quick observations. This is so serious, you guys. I walked in today because I honestly forgot to put masks in my car, and I walked in, and the room has a room. I won't say room full because it's not full. We're certainly exercising social distancing, but people are wearing their masks. This is serious business, and we cannot say it enough times. Please be thoughtful of your own health, but also for the health of others. Please wear your mask. And then I'm going to also say something very publicly, too, because the mayor has made some masks, and I'm asking if I can have one of the ones that she's made. Thank you so much. Hate to out you like that in public, but I'm chuckling, but this truly is a very different time, a very different time. We've reached a point now where many of us are feeling very isolated. I'm an extrovert extraordinaire. I've not seen my children in a month. It starts getting tough. It starts getting really tough for folks. And as you heard our health commissioners say, our numbers of people who are experiencing overdoses has increased significantly. We are now at 48% above where we were this time last year. The last time I was here, I talked about the numbers starting to tick upward. Well, they are truly ticking upward and staying up, and we've got to do something about that as a community. You've also heard our health commissioners say that we need to be kind, be compassionate, show compassion for others, help others out where you can. Those are not just words. That's a call to action, and it really has an important link to the fact that we're seeing the uptick in accidental overdoses because we need to each be our brother's keeper. This is one of those times when people are really struggling with the difficulties and the uncertainties of this current environment. We're working our way through it as we go. And we want to make sure that we are understanding what it has to feel like for some of our neighbors and our family and our friends who are in an unusual space with this. I really want to encourage you to reach out to them. People are not all coping well. I admit that I'm not coping really well. You know, the idea of the social isolation is difficult, even under the best of circumstances. And certainly when you think about folks who are losing their jobs, not sure how they're going to pay bills, not in touch with people on a regular basis that they're used to being around, they're struggling with that. People who have addiction and mental health issues are especially struggling with that. With the increase in the number of accidental overdoses in our community, we need to be paying very strict attention to how we're reaching out to one another. Folks are being left alone, they're isolated, they're being found days later. We need to make sure that we are paying attention to this. We don't know if we can say with certainty that it's tied to the pandemic, but when you start thinking about trauma, you think about the lack you think about the lack of access to people, lights out. That's an example. People with lights out, utility bills. I got to pay my utilities. How am I going to do that, right? I mean, think about the ways in which the people are really struggling with this experience. We could flip a switch. They can't, right? I think it's important to think about how little things can be exacerbated during this time. So there are a variety of things that people can do. And as caregivers, as friends, as neighbors, as loved ones, reach out. Let people know they can actually have access to health providers with telehealth now. It's an easy way for people to get connected. The behavioral health provider system is open and working and available to all of us in our community. We are fortunate because everyone is still operating with standard hours. It's a phone call, and likely it is also a phone call to receive health through telehealth or telemedicine. These are services that are available to citizens. In addition, we have a warm line in partnership with Goodwill Easter Seals. If you're beginning to feel stress, and it's not quite a crisis, but you're concerned, you know that you're not feeling your usual self, or maybe you want to talk about a neighbor that you've noticed being a little bit under the weather in ways that you've not experienced with them before, you can call the Warm Line. It is a free service. It operates Monday through Friday, 11 a.m. to 7 p.m. The phone number is easy to remember, 937-528-5777. In addition, we have our Adamus app, Get Help Now, Montgomery County. That can be downloaded, also free for iOS or Android services. There are a variety of ways in which people can reach out. If you're someone who likes to text, use the crisis text line. All you do to access help there is to text the number 4, HOPE to 741-741. If you're in crisis, an emergency situation, day or night, you can reach out to Samaritan Behavioral Health Crisis Care. That's always available 24/7 at 937-224-4646. You should not feel embarrassed or the least bit uncomfortable about reaching for services, calling for help. In fact, it is a very courageous and honorable thing to do to admit it when we need help and to reach out to get help before it becomes a true crisis. Please reach out to the people you trust. Text them, Skype them, call them. Because we say we are sheltered in place or staying at home, it doesn't mean we can't pick up the phone or we can't get them on the line through a Skype call to be able to look at them. That's how I'm looking at my daughter right now. She's a nurse. So I have to stay some distance from her. But I have to also be able to reach out to her because mamas want to know that their babies and their grandbabies, and I'm talking to you grandparents too, are doing well. So please use these resources. And last, we still have Narcan, or naloxone as some people reference it, available in our community for free. Please, if you are someone who has carried it in the past but your product has expired, reach out. We will send you new product. If you want to learn how to use it, we will train you over the phone. There are ways in which you can carry that because we've got to save lives. It's not just the pandemic, it's also the things that people are doing to try to ameliorate their pain. Silence isn't strength. Our efforts to help you continue, and we want to make sure we're reducing the overdose deaths, and we want to make sure that we're paying attention to people, helping them, being kind to them, being compassionate. Thank you so much.
Thank you, Helen. Next, we have Sarah Hackenbrack from Gadaha.
Thank you so much, Commissioner Cooper, Mayor Whaley, and Helen. It is an honor to always be here with you on these afternoons. And again, my name is Sarah Hackenbrack with the Greater Dayton Area Hospital Association. And what I'd like to do today is just cover a few of the items and give you a recap of where we've been this week as a reminder. And as we go into the holiday weekend, we recognize that people will be spending time at home. People may be doing some things around their house. And it's important to remember, again, that our region's emergency departments are open and they are available to care for you if you have an injury or an illness or you have a car accident. Any of those things that would traditionally take you to the emergency room and warrant that emergency care, we want to make sure that you know that our emergency departments are safe to care for you amidst COVID-19. They might look a little different. There might be protocols, and people might ask you some screening questions and take your temperature, but I assure you that they will take excellent care of you in your emergency crisis, whether that is an accident doing some yard work this weekend or maybe some heart trouble or breathing trouble. We want to ensure that you know that our hospitals are ready to care for you. We continue to work collaboratively as a region and work with our partners at the City of Dayton, as well as Montgomery County Public Health and Montgomery County Emergency Management Agency, to ensure that we are building the regional surge capacity that we are going to need amidst COVID-19. And that work continues. It will continue over the weekend and into next week as we work with our new partners at the Ohio National Guard and the Army Corps of Engineers as they look at spaces and the ability to increase the surge capacity within our healthcare providers. Again, our goal for the patients that end up contracting COVID-19 is to care for you within our region's hospitals and healthcare facilities to ensure that we give you the access to the medical equipment and supplies that you will desperately need during your treatment, and to ensure that the healthcare providers taking care of you are at the top of their skill set and their license to take care of you throughout COVID-19. And our hospitals are always there making sure that we are there to care for you regardless of COVID-19. So again, if you need emergency care, that is still going to be your best location for emergency care. It's one of our region's hospitals. We continue to be amazed with the spirit of generosity with this community as we go into the holiday weekend. Again, we can't thank the community enough for the donations of the homemade masks. Mine comes from Mayor Whaley, but many people have made homemade masks, and they've dropped those off to us at the St. Vincent de Paul Center over at 945 South Edwin C. Moses Boulevard. And we are still collecting homemade masks that we're receiving. We're having them laundered and sanitized, and then we are sharing those with our hospitals, our nursing homes and skilled nursing facilities, as well as our fire, police, and EMS personnel who also need to have masks available to them when they're out in the public and out doing the work that they do to serve the public. We also are incredibly generous donations this week that we've gathered from Emerson Technologies, as well as Crocs and Jobs Ohio and the Dayton Development Coalition. So again, thank you to those community partners and to many, many others who have reached out and provided some substantial donations to help us prepare for what is coming. As you prepare for your holiday weekend and perhaps the celebration of Easter, I want to remind you that we truly are in this together, Ohio, and we're in this together, Dayton. And the one ask that we continue to have of you from our hospital community as well as our healthcare workers is to continue to follow the governor's guidance and Director Acton's guidance to stay home. That is truly the safest way that we can help protect the infrastructure of the healthcare system that we have, but also those absolutely critical healthcare workers like our nurses and Helen's daughter who are going to be on the front lines taking care of people in this crisis. Thank you.
He gave us a scare there for a minute. We weren't sure he was coming up here. This is Michael Doe, Public Health Medical Director.
Good afternoon. I'm Dr. Michael Doe, and I'm the Medical Director for Public Health Dayton Montgomery County. Just so that you know what's going on here, they make a list of who's going to talk every day, and I never know if I'm on that list or not until I get here sometimes. So this is one of those times where I'm standing in the back and I'm saying, I guess I'm on the list, I need to say something. So what I want to do is share what I've been thinking the last day or two, what I've been hearing the last day or two. If we think about what the news was like before this, I don't have to tell anybody that's watching that this has disrupted everything. I mean, I would be surprised if there's anybody out there that this hasn't made some impact on how they're living their life. And if you remember back before this started, what was the news about? It's a political year. The news was about the primaries, about the candidates, about different issues. And one of the things that we heard as we went through that is that people were kind of coalescing behind a candidate, that they had a movement, if you will, and that people felt like they were part of something bigger. All right? So hold on to that thought for a moment about something bigger, being a part of it, and part of a movement. If we look at what has happened, and the reason that Sarah can get up here and talk about how the hospitals are doing pretty good, how emergency rooms are able to take care of people, they're not getting overloaded. If we look at the information about how we're flattening that curve, that is a result of individual decisions. So that in Montgomery County, we've got 540,000 plus people. If each of those people just makes one decision a day over the last 2 weeks about how to do things differently to protect themselves and their neighbors, that is millions and millions of decisions that have been made. And of course, it's not just one decision a day. People are making decisions constantly through the day, whether to go to the grocery, wearing a mask when you go to the grocery, if you're just going to get the groceries ordered or whatever, if you're going to stay home, if you're going to help a neighbor, and how to do that efficiently. Is that an essential visit or not? I mean, as a group, we have accomplished getting this thing sort of looking manageable, perhaps. And it has been millions and millions of individual decisions. And I feel like I've never been part of a bigger movement than that. I've never been part of something that big with that many individual people all pulling in the same direction at one time. And it's been successful. The other thing I've been hearing is people are saying, well, now that it's successful, it's worked. Like in the past tense, it has worked. I want us to keep thinking it is working, and that all those millions of decisions, we got to keep going with that. We have to keep thinking about all the different things that we're doing, how this is impacting us, that, yes, it's getting tiresome. Yes, some of us may be suffering, as Helen Jones Kelly said, more than others, and we need to watch out for those people. And that may be a necessary visit. If you know somebody, a neighbor or someone that has had troubles with mental illness or depression or whatever. But we need to keep making those decisions in a responsible way. And this is like the wrong time to say, oh, we've won. I think, not to pick on any particular president, because I can think of presidents from both parties who have announced victory, and then we've gone on for years. And so I think this is the point at which we're beginning to feel like we've accomplished something, and we have, but it's not the end. And we need to keep making those individual decisions. And I would just implore, especially as the weather gets nicer, and as we have choices, tough choices to make about this weekend, and our participation in religious services or other kinds of things, that we continue to make the same kinds of decisions, and that we keep this movement going the way that it has been, and that we can stick together as a people to do that. Thank you.